Let me just start by setting the record straight on a few things I've been hearing out here about reform. Under the reform we're proposing, if you like your doctor, you can keep your doctor. If you like your health care plan, you can keep your health care plan. You will not be waiting in any lines. This is not about putting the government in charge of your health insurance. I don't believe anyone should be in charge of your health insurance decisions but you and your doctor. I don't think government bureaucrats should be meddling, but I also don't think insurance company bureaucrats should be meddling. That's the health care system I believe in. So this is what reform is about. For all the chatter and the yelling and the shouting and the noise, what you need to know is this. If you don't have health insurance, you will finally have quality, affordable options once we pass reform. If you do have health insurance, we will make sure that no insurance company or government bureaucrat gets between you and the care that you need. And we will do this without adding to our deficit over the next decade, largely by cutting out the waste and insurance company giveaways in Medicare that aren't making any of our seniors healthier. Right. Now, before I start taking questions, let me just say there's been a long and vigorous debate about this, and that's how it should be. That's what America's about, is we have a vigorous debate. That's why we have a democracy. But I do hope that we will talk with each other and not over each other, because one of the objectives of democracy and debate is that we start refining our own views, because maybe other people have different perspectives, things we didn't think of. Where we do disagree, let's disagree over things that are real, not these wild misrepresentations that bear no resemblance to anything that's actually been proposed.